Dealing with back pain can be really annoying and frustrating. And if we're doing the wrong stretches, then it can cause us more problems long term. So we're gonna dive in with this with the 3 ultimate stretches, the best stretches that you can do for your back pain to get you out of it. My name is Jonathan Rizika. I'm a specialist in back pain. We do manual therapy at my clinic. I have a doctorate degree in physical therapy. I've been doing this for 14 years, making sure that people get better, but that they stay better long term. These are the things we're gonna teach you in these videos on exactly what we do with our clients to keep them better so they don't continue to come back with the same problem. Low back pain is often because of a hypermobility. We're moving too much. Think about this as the spine. We got all these segments right here, and we got these segments below, and then we just move too much in one area. So that's causing irritation, and what we end up getting when we have an irritated segment, we move too much and the muscles will tighten up around the area, and that becomes counterproductive as well. So what we want to do is make sure that we're lengthening the tissue and getting stretches that are going to move above and below those segments. If we move more diffusely, then we're not moving that one segment, and that hypermobility doesn't become as big of a problem. Let's dive into it in this video, the top 3 ultimate stretches, the best stretches we can be doing for our back pain. The first stretch that we want to be doing is going to be for our hip. So we're actually going to have 2 stretches that are going to focus on the hip. When we are thinking about movement through our body, we need to be keeping our Superman or Superwoman emblem stacked over our belt buckle. And so we should be moving through our hips and keeping a stationary position. So we got to be able to move through this area, but we shouldn't be moving through it consistently or continuously. When we're working on our low back, we're going to think about stability and mobility. So we need to increase mobility through our hips. We need to increase mobility through our thoracic spine. And so we also have to increase stability. Our body is reacting to that hypermobility by tightening up those muscles. So we want to increase the mobility in those areas. So we have to follow it up with exercises. Make sure you subscribe to the channel, hit the bell icon so that you can follow us for videos on how we increase stability in those areas as well, because it's going to be really important. We want to make sure that you don't miss out on any of that content. The first stretch that we do for our hips is actually working on our glutes, and we're gonna make sure that we can move through this area and that my low back doesn't move. So I need to be able to stretch through this area. The best way to do it is an active pigeon. So we get on the ground or on a table like this. Instead of lifting my leg up like this to get over, I'm actually gonna just push my left leg underneath my right, and then I'm gonna shift back right here. So now I'm working on external rotation of my hip. I'm gonna hold this for 10 seconds, and then I'm gonna use my glute to drive me back up for about 5 seconds and then drop back down into it. I'm gonna do that 5 times. So I'm working on external rotation right here and then letting it come back down. I should be able to get a little bit further each time. This is an active component to a stretch, and I wanna make sure that I'm breathing really well. Driving up, and then I'm coming back down into it and just resting. I am not folding in my back, and I'm not twisting over to the side. I'm going straight back, and then I'm just sitting down in that hip, not making movement come from my low back. Now, if you're having knee pain or you have any problems with that stretch, then I want you to do it laying on your back. So when I do this one, I'm coming up to the opposite shoulder. So I'm gonna put my leg right here. I am not lifting up in my back right here. I'm just moving through my hip, and I'm coming to my opposite shoulder, and I'm holding that for 10 seconds. I'm gonna push for 5 seconds, resisting with my arms. The primary mover is my glute. And then I'm gonna pull up to my opposite shoulder again, just breathing through it. Same thing, I'm gonna do it 5 times. I'm gonna do it on both sides. And you'll notice that when I get up from a laying down position, I don't ever lay down straight back. That's gonna put a lot of pressure on my lumbar spine. I'm gonna lay down to the side, and then I roll back. And so same thing when I come up, I press my elbow down, and I'm teetering on my elbow, dropping it underneath my legs and coming up to the side. That's gonna keep stress off your back when you're moving through these stretches, which we want. We need to string together just a couple of days with decreasing stress on our low back so we can get that movement to come through the hips and the thoracic spine. Number 2, we're gonna do a hip flexor stretch. So what I wanna do is get into this position right here, and I'm gonna keep my chest with my thigh, and I'm shifting forward. I'm squeezing my back glute right here. Same thing, 10 seconds. I'm not getting to a point where I'm putting a ton of pressure on my knee. I don't wanna create knee problems while I'm fixing my back problems. So I get my foot out. If my knee goes in front of my toes, it's just slightly in front of my toes, not too much. And I'm not letting my knee tip inward right here. I'm pushing pushing it out to the side, and I'm breathing with it, squeezing that back glute, and then I'm gonna do the same thing. This is our active component, is that I'm gonna pull myself back using these hip flexors for 5 seconds, and then I'm gonna drift back down into it. And I'm staying with my thigh as I do that, and I'm gonna do 5 sets of that one, and then I'll switch sides. Now, if I want to do the same stretch in standing, I can just shift back. I'll come over here. So I'm going here, and I'm going to be in a standing position right here, and I'm drifting forward, going into that leg, not putting too much pressure on my knee. Same thing, pushing that leg out to the side and squeezing that back glute. And I'm gonna maintain this for 10 seconds, and then I'm gonna pull back for 5. And I'm gonna do 5 sets of that on each side. If you ever have problems with your knees and we wanna do more of this stuff in standing, if we can progress to a position where we're on our knee and we're isolating that area better, we're isolating a chain of tissue. It's not just one muscle. So isolating that chain of tissue is going to be the best way that we can do it, but don't hurt yourself at the same time. Now, with most back problems that we see here in the clinic, people are moving too much through the lumbar spine. So we've got to think in the lumbar spine right here, what's above and below. So above is going to be the thoracic spine and below is going to be the hips. So we talked about doing the front with our first stretch, it was the back of the hip. And then our second stretch was the front of the hip. So we're working on both sides of the hip, front and back. So we're getting that motion coming through our hips consistently. And then now we got to work on the thoracic spine. We have to be able to move through this area where we're not just hunkering down through that hypermobility, through that area that's moving too much in our low back. So we're gonna move through the thoracic spine. So I'm actually gonna lay down, and we just call this open book. And so I'm coming here off to the side. I'm gonna turn my thumb up, and I'm watching it. I keep my shoulder away from my ear, resting my head down on my other arm. And then I'm reaching up and coming across, driving down and back with my shoulder blade at the same time. So I'm gonna do 10 seconds looking at that, breathing and relaxing, and then I'm going to come back down, take about 5 seconds, and then 10 seconds coming back up. Now I'm doing that. I'm going to do 5 with one side and 5 with the other. I'm really focused on moving through the thoracic spine and getting that mobility right there. Now, if you want to condense this down, we can work the hip flexor at the same time as our thoracic spine. So I'm going to do that. I'm going to come up, and when I come into this stretch right here, as I drift forward, I'm drifting into this thigh, breathing, squeezing my back glute, and now I'm gonna rotate this way, looking at that thumb, and it's coming up, and I'm driving that shoulder blade down and back through this area, through my rib cage, and I'm holding it for 10 seconds, squeezing that back glute, and then I'm pulling back with this hip so I can condense it down into one. And I'll show you from the other side. I'm coming forward right here, and I'm holding that, making sure that I'm hunkered down, get in the right position first. And then now I'm gonna rotate, looking up at that thumb. I can put my hand down like this, and I'm squeezing that back glute. I'm holding it for 10 seconds, and then I'm putting my hand right here, and then pulling back with that hip flexor, and then I'm drifting back down into it and holding that stretch for 10 seconds. So I'm increasing mobility in the right areas, and we're condensing it down so that it doesn't take us as long. Remember that we're gonna consistently be doing this. We wanna do it twice a day, consistently, do it for a week. You're gonna see a huge improvement in your back pain, and we're doing it with stretches. Make sure that you're going to the exercise videos so that you know exactly what you should be doing. This is a daily practice for daily pain. So we're going to get out of daily pain by doing our daily practice of increasing our mobility in the right areas. Make sure that you check out the videos that are here on the page with exercises, exactly what you need to do long term to make sure that the pain doesn't come back. We increase our mobility, we got to increase our stability at the same time, and then we can control a lot more effectively what we're doing with all of our joints and not putting too much stress on them if we have the right muscles firing, and that's going to come through our glutes and our scapular retractors, the stability muscles in our shoulder blades and in our hips. We'll see you in the next video. Get mobile and stay active.